Perfect. So for you last holdouts, hopefully this will be helpful. So I'm going to talk about a couple of different strategies that I've gleaned from my practice as a gender-affirming surgeon or genital reconstructive surgeon. I don't have any disclosures in direct conflict with this discussion, except some patent stuff with the app I'm going to show, but it's not for sale, so it shouldn't conflict. So I'm a reconstructive urologist. I focused on genital reconstruction. With genital surgery, there's often more than one surgical option available. And with each option, there's always a complex list of costs and benefits. Costs come in the form of morbidity, foregoing certain desirable features like standing to urinate, as an example, or getting a vaginal canal for vaginal receptive sex, and then either foregoing benefits or gaining benefits. Or being able to forego some significant morbidity, that's a benefit, or gaining certain desirable features, again, like standing to pee with urethral lengthening or gaining a vaginal canal. One rule of thumb that I think a lot of us probably know from our practices is that there's really only one correct choice for surgery for patients for these elective surgeries. And that correct choice can only be made by the patient, and it's the choice that best balances their appetite for costs and for benefits. Again, it's per individual patient. A second rule of thumb is that, I think a very wise saying, which is, we don't know what we don't know. That's a very true statement. So here's what I'm going to present on. On the one hand, from a provider's perspective, we have to acknowledge that we never know what we don't know about the patient's needs, about their personal priorities, what their appetite for cost and for benefit is. And from the patient's perspective, we don't know what they know or don't know about benefits and costs, about each surgery option. They go into this often very naive. So today I'm going to discuss two strategies to address both of these key challenges that we face. So PROMs, patient-recorded outcome measures, they are very helpful. We've done these, looking at patients who chose one surgery or the other, and we've queried them about what drove their decision-making. And what we find is that what's important to all transgender people, regardless of their choices, to eliminate their genital, their birth anatomy, the genital anatomy that bothers them, and then to be able to look normal and function and have sexual sensation. And then as the list goes down, they're also important. Sorry, this thing kind of runs on its own. As we go down the list, they're also important, but a little less important. And that's great, but it's very backward looking. We were asking patients who've had surgery what drove their decision making. In a perfect world, we want to be able to be forward looking. We want to be able to understand how to present things to patients in a way that they figure it out prospectively. So there's something called conjoint analysis. Maybe some of you have heard of it. It's a commercial or retail marketing research tool for understanding consumer decision making based on how an individual values and prioritizes available options, which in the language of this stuff is called attributes, and how this guides future decision making. So for example, a bottle of dish detergent, would you buy it if it cost 5 cents more? But they gave you a tiny bit less. Would you buy it? And they keep answering questions where someone's changing the price, how much you get, how effective it is, etc. So the point is that conjoint analysis is very powerful, but it's iterative. So people are constantly facing scenarios and saying, I would choose this one, now I would choose that one, etc. The drawback is that it's very time consuming. So for patients who've still not chosen their surgery, we created a conjoint analysis battery of queries, and we listed fixed costs, things that they can or cannot have, and then assigned likelihoods for complications based on our institution's complication outcomes rates. We used software which might interest you called Question Pro. It lets you make your own conjoint analysis, and it's fairly simple to use. And the result that we found was interesting. Very few patients bothered to Very few patients bothered to finish this because it took so long. And it took so long because there were so many variables. So conjoint analysis is very helpful, but if it has more than 3 variables, it ends up taking a long time to generate enough random mixes of options to be useful. So what we learned is that we made what we call a conjoint analysis summary tool, which shows patients on the left in green all of the different attributes or options, and then in the middle and far right column, the 2 different surgical options. And we just said, stand to P, you only get it if you choose urethral lengthening, and you don't get it with the other one. Complication risks, and then it's quoted for urethral lengthening, they're much higher, very low for no urethral lengthening, et cetera, et cetera. And what we found is that patients really like this because they skim it and they, in their own head, quickly figure out which options, which attributes are most important to them, and then they look to the right and they see whether they get it or not in different surgical options, and they just kind of quickly do it all in their head. I don't know how else to describe it. So something like this is very helpful. We made one for phalloplasty, with and without urethral lengthening, because otherwise the surgeries can be identical. And then we made it for vaginoplasty. Jesus, this thing is driving me insane, but we're almost done. And we have one for phalloplasty and vaginoplasty, and that's it. So they reported a very high satisfaction. The other thing I'm going to show you is about visit audio recording. So for patients, they don't know what they don't know about the surgeries. So the only solution to that is for the surgeon to tell them as much as they possibly can about all options and not make assumptions. And they depend on the provider to give them as much information as possible. The problem is that we all know that our patients forget over 50% of everything we discuss in a long discussion session. That's just a reality. So it's difficult. And if you look at patients and ask them how much, if you make a recording and show it and give it to them and ask them how much of this do you think you would have forgotten, they estimate about 50%, 55%. Taking notes in discussions is a distraction for patients. While they're writing, they're not listening to what you're saying. And they're also just not engaged in the discussion as well as when they're not taking notes. And then we also noticed that patients often call the office asking questions which were answered in the consultation, which affects our practice adversely and undermines patient clarity. So we developed an app called Visit Replay. It's going to be out soon, but it's not out now. And it's very simple. It lets you make an audio recording of the entire visit. You enter the patient's first name or initial, last name, and their email address. And then you press a button and it records up to 1 hour and 20 minutes of discussion. And then at the end of the session, I tell them, I'm going to email this to you before you leave my office. And I press send, and it forces me to CC myself, so that the provider should never give a patient something that they don't keep a copy of themselves for medical legal protection. And the app also lets the provider make attachments, send a list of frequently asked questions and answers. Things that they're likely to call back about or likely to be unclear about. And it's very useful. It also lets you put links in there to a page that I control with pictures or videos or publications of mine or someone else, etc. And we looked at this and found that patients were very satisfied with this. It decreased decision-making anxiety, significantly increased confidence in treatment choice making, and increased a sense of autonomy and satisfaction. And also one other thing, if you think about it, the human voice conveys a lot of metadata that beyond just facts. Facts you can type, but if you're nice to patients, if you're concerned, if you're thoughtful, if you connect with them, the recording replays that over and over for them when they listen to it. And we found that patients listen to it an average of 2.3 times. Like 70% of our patients listen to the recordings. They listen to them with other people. They listen to them from as early as hours after the visit to a month after. So, it's just very helpful. In the future, I'm almost done here. I'm trying to advance the slide. So everyone always asks about medical legal concerns. It's good. I practice at Cedars-Sinai, a very risk-averse institution. We have a lot of movie stars and stuff in LA. And our risk management department said, we think this is fantastic for the institution. It protects the provider and the institution as long as we keep a copy of it. So I just email it to myself and leave it behind a HIPAA firewall, and I never even do anything with them, just leave them there. But in case we ever need them, we have them. Providers always ask, what if I don't say a certain complication? Is that a huge liability? No, the legal standard is that you have to, meet the standard of care of risk discussion and just talk about the most likely complications and make an effort. So as long as we do the right thing and the visit, we're fine. In conclusions, PROMs should guide an understanding of patient priorities, but the overarching goal is to help patients prospectively with decision making. Our conjoint analysis summary tool is useful to patients, and anyone can make one. Third, the visit audio recording is overwhelmingly helpful to patients, and it increases visit quality and patient understanding. And there's really no medical legal risk with this. If anything, it's medical legally protective. If you have any questions, I'd be happy to share the app with you. Just you can have it and use it, and tell me what you think about it, and I'd be glad to answer questions by email or something, since we're probably over time.
Thank you.
Thank you.